This presentation is on mental health in Mexico. It was researched and written by Caitlin Kukuk and myself, Bradley Moore. This was created for the class International Perspectives in Health, Mayville State University. Okay, so first, I wanted to list the objectives that we will go over in this presentation. We will define what mental health is. Then we will explore the statistics of mental health in Mexico and compare and contrast the statistics with other countries. We will then explore the stigma associated with mental health in Mexico. And finally, at the end, I will refer you to the handout for some interactive questions and what other ways you can help the problem. Okay, so what is mental health? The World Health Organization, or WHO, defines mental health as a state of well-being in which each individual is able to realize his or her own potential, cope with the normal stress of life, work productively, and make a contribution to the community. Furthermore, mental illness refers to all mental disorders with definable diagnosis. These disorders are manifested in significant dysfunction that may be related to developmental, biological, or psychological disturbances in mental functioning. Some examples of mental health disorders include depression, anxiety, schizophrenia, eating disorders, and addictive behaviors. According to Psychology Today, there are signs of mental health risk. These could be a change in personality, if someone is acting like a very different person, or not acting or feeling like themselves. This is a warning sign. Another is uncharacteristic anxiety, anger, or moodiness, social withdrawal and isolation, lack of self-care or risky behaviors, and a sense of hopelessness or feeling overwhelmed. According to WHO, around 151 million people suffer from depression, 26 million from schizophrenia, and 125 million from issues related to alcohol and drug abuse worldwide. 40 million more suffer from epilepsy, 24 million from Alzheimer's and other types of dementia, and 844,000 people commit suicide every year. WHO also claims victims suffering from schizophrenia, anxiety, depression, bipolar disorders, or addiction problems are a vulnerable group. So let's look at Mexico in particular. According to Medelita.com, there are an estimated 10 million people with mental, visual, hearing, or motor disabilities living in Mexico out of 129 million people. That's over 7.5% of the population. Mexico's budget for mental health makes up about 2.5% of its overall health spending. What's worse is WHO predicts global costs of mental health issues to grow to $6 trillion by 2030, while in 2010 they were $2.5 trillion. Mexico's mental health system is so dysfunctional that the unlucky patients under its care are casually referred to as abandonados, the abandoned ones. 1 out of every 4, or 25%, of Mexicans between 18 and 65 years old have suffered a mental illness, but very few get treated. It is estimated that the wait time is between 4 and 20 years to receive medical attention at a public health institution. The report on the mental health systems of Latin America show that in Mexico, resources destined to mental health treatments are insufficient, and most of them can only be found in psychiatric hospitals. A 93-page report from Disability Rights International revealed the horrific living conditions at Mexican mental health facilities, which are a breeding ground for human rights violations and abuse of handicapped patients that these institutions are meant to help. Many patients never receive a clinical diagnosis of their condition and don't have families to give them private care. These patients remain locked inside the hospitals indefinitely and become completely anonymous to the world. According to Medelita.com, many of the patients in these institutions have been detained against their will for many years and will likely be detained in this dreadful situation until their death. So, what about the stigma attached to mental illness? Mariana Castilla, who holds a master's degree in human rights and democracy and worked at the National Human Rights Commission, or CNDH, pointed out that people with psychosocial disabilities suffer discrimination in political, economic, and working environments, as well as within their social circles and families. In her experience, healthy people find it hard to understand mental health problems, such as anxiety or depression. At the CNDH, Ms. Castilla handled cases related to human rights violations. She often met people who couldn't give a coherent speech, but once she understood their context and personal situations, she discovered that at some point their families had excluded them, leading to a situation of violence which often aggravated the mental disorder. In other cases, these people would look for a job, but companies often denied them the opportunity once they found out that they had been diagnosed with a mental illness. These types of consequences of discrimination lead to poverty, where the person might end up living on the streets or becoming economically dependent on their families and close friends. In one example I had read, a Mexican woman was sexually assaulted on a bus trip. When she reported it to the police and the police found she had been taking her prescription for anxiety, the police manipulated her statement to a point where they established that she could not have been aware of the assault due to her taking the medication. The woman's response was that it was a 12-hour trip. She was going to sleep at some point with or without the medication. In the end, her mental health was used against her. In Mexico, discrimination is still one of the main obstacles for getting access to treatment. Depression is still seen as a weakness, while anxiety is viewed as a mere personality trait that the person at hand should be able to control. Suicide is the main cause of death among young people. People ignore depression for two reasons. People don't recognize it as an illness, and patients often refuse to get treated because of the stigma. So what are some of the things we can do to address the problem? First, we should all understand the illness. I hope that I brought some of that understanding today, the seriousness of the disease. Further, I will list a few items here that could be done. This is also in the handout. And speaking of the handout, there are a few questions that I will list the answers to at the end of this video. So look through that before getting to the end, or you can always pause. For Caitlin Kukuk, my name is Bradley Moore, and this was a presentation for the International Perspectives in Health, Mayville State University. Thanks for watching, and stay tuned for the answers on the handout.